If you have high cholesterol, you may have been told to follow a diet to treat this condition. Unfortunately, in many cases, dieting only tends to make high cholesterol worse. So if dieting isn't the solution to managing your high cholesterol, what is? In this video, we're gonna go over what high cholesterol is. I'm gonna tell you why a diet is not going to work to treat your high cholesterol. We'll talk about if weight loss will help lower your cholesterol. And finally, I'm gonna share some tips on how to manage high cholesterol with a non-diet intuitive eating approach. So first things first, what is high cholesterol? Otherwise known as hypercholesterolemia, high cholesterol is a condition where the total cholesterol levels in your blood are elevated. While we do need some cholesterol in our blood for cell function, too much of it can increase the risk for heart disease and stroke. Cholesterol comes in two primary types. The first one being LDL, which is low density lipoprotein, and HDL, which is high density lipoproteins. LDL is frequently referred to as the bad cholesterol because it can lead to buildup in your arteries. And on the other hand, HDL is often referred to as the good cholesterol because it can help the body get rid of excess cholesterol to prevent that buildup. High cholesterol is diagnosed using a blood test known as the lipid panel or the lipid profile. This blood test often measures your LDL, your HDL, as well as your total cholesterol. The lipid panel also tests your triglycerides, which are not a type of your cholesterol. There are various causes and risk factors that can lead to high cholesterol, including genetics, age, your sex assigned at birth, your diet, the amount of physical activity that you do, as well as tobacco use and alcohol consumption. It's important to note here that there is a lot more impacting your cholesterol levels than just diet and exercise. Sure, those are two components that could possibly lead to a high cholesterol diagnosis, but they're not the only two factors. You can eat a very nutritious diet and have a very balanced exercise routine and still have high cholesterol. So you just received a high cholesterol diagnosis. Let's talk about how high cholesterol is treated. When it comes to treating high cholesterol, it's important to remember that there are non-modifiable risk factors and modifiable risk factors. These non-modifiable risk factors are the factors that are out of your control. So as I just mentioned, even if you have a balanced, nutritious diet and a consistent exercise routine, you can still get high cholesterol due to those non-modifiable risk factors such as age, genetics, sex assigned at birth, and in this case, your doctor may prescribe you medications to treat your high cholesterol. The modifiable risk factors are the ones that you do have more control over. These include your diet, your exercise levels, your alcohol consumption, tobacco usage, and to some degree, your stress levels. I want to make a note here that these modifiable risk factors do not involve dieting or trying to shrink your body, which is a great segue into our next topic, and that is why diets don't work for treating your high cholesterol. While there may be various approaches for treating high cholesterol, one approach that I don't recommend is going on a restrictive diet. And unfortunately, this is what many who get this diagnosis are encouraged to do. But this approach has so many disadvantages. You might assume that because weight loss advice is so frequently dished out, that this would be an effective solution to treating high cholesterol. Yet, upwards of 97% of people who lose weight through dieting regain the weight that they've lost within 2 to 5 years. Not only that, but many people who lose weight through dieting end up regaining more weight than they lost, putting them at a higher weight than where they even started. Simply put, diets don't work, including for those who have a diagnosis of high cholesterol. If you have tried treating your high cholesterol by going on a diet and it did not work for you, don't blame yourself. You are not the problem. Your body is not the problem. Weight loss programs have an astronomically high failure rate, yet we continue to blame it on our struggle to stick with it and our lack of willpower. Now, you might be wondering, won't weight loss improve my high cholesterol though? Telling someone with high cholesterol to just lose weight is frankly, terrible advice. But unfortunately, this is what happens to many people who get that diagnosis, especially those in larger bodies. But as I just mentioned, dieting attempts are going to fail a large majority of the time, whether you have high cholesterol or not. And people in all sized bodies can have high cholesterol. And it's important that those in larger bodies receive the same care as those in smaller bodies. Because believe it or not, there are not any health conditions that happen to only those foods in larger bodies. Now, some people may lose weight when they are treating their high cholesterol due to nutrition and exercise changes. This does not automatically mean that the weight loss is what improved their high cholesterol. The behavior changes are likely what improved their high cholesterol. Eating more nutritious foods, exercising more, decreasing their stress, that is likely what decreased their high cholesterol, and weight loss just happened to be a side effect of that. So how do we treat high cholesterol if dieting is not the solution? Enter intuitive eating. Intuitive eating, or a non-diet approach, is a really great way to manage your high cholesterol without cutting out your favorite foods. Intuitive eating involves learning to listen to your body rather than relying on external food rules. There are 10 principles of intuitive eating, but the one I want to focus on now in this video is principle 10, which is gentle nutrition. Gentle nutrition is essentially the intersection between fueling your body with the nutrients that it needs, while also eating foods that you want to eat and that you enjoy. And there are a few ways to incorporate gentle nutrition to help lower your cholesterol. The first one is to choose mainly unsaturated fats. Saturated fat is one of the largest dietary contributors that may lead to increases in LDL levels. And being mindful of your saturated fat intake can help to lower those LDL cholesterol levels. You can find saturated fat mainly in animal products such as high-fat meats and high-fat dairy such as cheese, ice cream, and butter. Now, as a non-diet dietitian, I often recommend considering what you can add to your plate rather than take away. So when it comes to treating your high cholesterol, rather than focusing on cutting out saturated fat, let's focus on adding in the unsaturated fats, because you do not need to avoid the saturated fats altogether. Because the fact of the matter is, when we cut foods out of our life, it makes us only want to eat them more. Food restriction is one of the main indicators of binge type eating. Polyunsaturated and monounsaturated fats may help lower your LDL cholesterol levels. These can be found in fatty fish, nuts and seeds, and in liquid oils such as olive oil, avocado oil, and even canola oil. I know, that one's controversial. I've got a whole video here if you want to learn more about that. The next way to incorporate gentle nutrition to treat your high cholesterol is to increase your fiber intake. Soluble fiber specifically can help to lower your LDL cholesterol levels. Soluble fiber absorbs water in the stomach to form a thick, jelly-like mass that moves through your intestines and grabs cholesterol to be excreted. Fiber is found in plant-based foods. Choose fruits and veggies like asparagus, oranges, sweet potatoes, Brussels sprouts. Foods such as legumes and oats are also a really great source of soluble fiber. As you do increase your fiber, make sure you are drinking plenty of water to prevent constipation. Limiting your alcohol consumption can also be a helpful way to lower your cholesterol levels. High levels of alcohol intake can increase cholesterol levels due to how it is processed in the liver. While some individuals may be able to enjoy an adult beverage here and there, as a dietitian, alcohol is the one thing I am not going to encourage drinking more of. And my last tip on how you can treat your high cholesterol with a non-diet approach is to incorporate joyful movement. It's likely no surprise to hear that exercise is good for you. However, more is not always better. Joyful movement is the key here. There is no place for using exercise as a punishment or a way to make up for the foods that you ate. By finding movement that you actually enjoy doing, you will be able to do it more consistently. So bottom line, can you treat your cholesterol with intuitive eating and a non-diet approach? Yes, you absolutely can. Intuitive eating may look different for those who are treating a condition such as high cholesterol, but this does not mean that you have to go on a diet and that intuitive eating is not possible for you. If you're ready to learn more about intuitive eating and incorporating a non-diet approach so you can make peace with food, be sure to check out episode 1 of my intuitive eating series that I will link right over here. Thank you guys so much for watching this video, and I will see you next time.